A lot of this is still anecdotal, but my colleagues in Europe who I've been working with to get a hold of these prized treatments have seen almost complete remissions in rather aggressive cancer situations with multiple IV treatments without the side effects like chemotherapy. So they've been sharing that with me. I have the protocols that we're going to follow. And frankly, a lot of things we do in regenerative medicine or stem cell-based medicine, which this falls under, all the good protocols and things that we've learned to do come from Europe. They've been ahead of us by about 20 years. We're a little behind here in the States. So, they have the publications, the follow-up, things like that. So we're hoping to have at least as good of results as they do.
When it comes to immune defense, natural killer cells are your body's front line, targeting viruses and abnormal cells fast. But they don't work alone. Zinc is essential for activating and supporting natural killer cell function. That's why I always recommend a high-quality zinc supplement as part of any immune-boosting routine. Breast Cancer Conqueror's Super Zinc is a highly affordable option. It contains 30 milligrams of zinc per capsule and is great for supercharging your immune system. Head over to breastcancerconqueror.com and look at our store to check it out. Welcome everyone to an episode of Wellness Warriors. This is your host, De'Ann Richter. I am 7 Essentials coach with Breast Cancer Conqueror for the last 10 years and currently speaking with Dr. Gross, who has some really interesting information to share with our audience about a type of treatment plan people can consider, natural killer cell exosomes, that some people might not know a lot about. So just to tell you guys a little bit about who we have with us today, Dr. Jeffrey Gross is a leading neurological surgeon with a passion for regenerative medicine. He is a graduate of UC Berkeley and George Washington University School of Medicine, and he's had extensive training specifically in the area of spinal biomechanics. He specializes in athletic injuries and spine procedures, but he also offers cutting-edge biohacking and longevity consultations. This is a big statement. Dr. Gross has been recognized as a top doctor since 2020, so that's really impressive. And he has also founded a company called Recelebrate with C-E-L-L, Recelebrate, which is a company focused on anti-aging treatments and also using surgery only when absolutely necessary. So quite a background. Dr. Gross, thank you so much for being with us today.
Thank you so much. It's my pleasure to be here.
So I mentioned earlier, what you're going to speak with us mostly about today is NK Cell Exosomes. So would you mind just briefly explaining exactly what that is?
Sure. So NK stands for natural killer cells. And that those cells are part of our immune system, part of our white blood cells. It's a small percentage, maybe 2 to 3% of our white blood cells are natural killer cells, and we enjoy them during our lifetime. Their job is to circulate around the body and identify and remove completely deranged and messed up cells, like accidental cancer cells that we make throughout our life and get checked out by this system and removed selectively. Also removed would be senescent cells that are aged, inflamed, releasing leaky toxins into the bloodstream, but taking up resources, but not contributing back, right? So those are also known as zombie cells. So NK cells are good at doing that. They can be activated by other T cells as part of the immune cascade of things. They can also be act on their own. They don't need to be sort of encouraged. If they find one of these cells that's messed up, they kill that cell without harming normal cells by releasing small vesicles called exosomes that have these enzymes in them that go into the recipient cell and basically cause it to lyse or break open and explode and release their contents. So that is a cool natural way that our body helps us remove cancer cells. Well, guess what? We now have that as a therapeutic. That's what's very exciting. Now, this is very, very cutting edge.
Yeah, that's really interesting. It's another, in layman terms, maybe you could say these NK cells are and correct me if you have another way of describing it, but kind of like the first line of defense, this immediate kind of go out and find these rogue cells. And so now using these exosomes, I can see how that can be a very cutting edge way of treating different diseases. And so, would you mind then sharing with us how you can use these NK cell exosomes as a way to change the way maybe that we treat things like cancer?
Yeah, well, NK exosomes have been shown in different models, both in cell cultures, in animals, and in some human studies, to help remove these abnormal cells. They can be used in different ways. So they can be used first as a preventative. Let's say someone is at high risk. Maybe they have a BRCA gene. Maybe they have family history of cancer. Maybe they had cancer in the past. They're in remission and they want to stay that way. So it would be a strategy to, have some of these NK exosomes boosting your ability to remove these cells. So that could be done through an intravenous, injection, right? And it could be done periodically or what have you. So we're figuring out the strategies in a precise way, meaning everyone's different, depends on what they need. And we're learning more about this every day. So you would be part of that learning curve with us. You might use it as an augmentative therapy. Let's say you're doing some other things, maybe even some traditional things. Maybe they're not even some of the cutting edge natural things. You might use NK exosomes in between cycles of other treatments or before and after other treatments to augment and amplify those things, the ability to catch circulating cells. Let's say you had a localized mass that maybe was removed. And, some people think surgery, the body's walling this thing off and the surgery could sort of disrupt it and exacerbate and release cancer cells into the body. So it might be something you do before a surgery. So these things are circulating in your bloodstream, these NK exosomes. So if accidentally some of those cells are released, and you have a boost in NK exosomes to do that. So why do you need additional NK exosomes? Because we find in people with cancers have a low number and low functionality of their own NK cell system. So this is sort of to help you. Maybe that's one of the reasons they ended up getting cancer in the first place. They couldn't clear it out. Who knows? Could be a contributing factor. And we're learning more about this. And probably the last application is one thing that's really cool about NK exosomes is they can be injected into a solid tumor. And they're so small, they're 1/1000th the size of a cell. Cells are small already, but these are even smaller. So they can penetrate through the tissue layers. They are not disturbed by the anti-immune mechanisms, defense mechanisms that tumors make around them. So they get into what's called the tumor microenvironment easily. So we really like the ability for NK exosomes to sneak in and do their damage to cancer.
Very interesting. A lot of different applications. And you mentioned, why would someone need more NK exosomes? And it's my understanding that one issue is that they may weaken as we age. Can you explain a little bit about that?
Sure, all cells tend to lose their ability to be optimally functioning as we age. And by age here, I'm speaking to accumulation of chronic inflammatory stresses and damages. I'm not speaking to your number on the calendar or how many candles you had on the last birthday cake. Okay. Because we're talking about biological or physiological age. What has your body had to deal with throughout your life? How much, what things in your food or water or air or electromagnetic fields have been exposed to. Even neurostress, even actual psychological stress can impact the health of your cells. So if your cells are busy fighting off the environment, they can't work in optimal mode. They're too busy in defense mode. And in doing so, all of our cells lose their ability to function. Our stem cells tend to lose, you get what's called stem cell exhaustion. That's one of the theories of aging. Well, our NK cells are cells that get affected this way too. And as they become less functional, and that's an observation here, people with cancer have lower numbers and lower functionality of their NK cell system.
Very interesting. Yeah. Yeah, it emphasizes, again, the importance of environmental factors, right? You always want to make sure you're eating as healthy as possible, good for you, protecting yourself from toxins. It's very important part of a human journey. Yeah.
Right.
So many of the women that work with us or that listen to this podcast or anyone who listens would maybe be considering some traditional treatments. You mentioned them earlier, and you mentioned that even NK cell exosomes may be able to be used in addition to some of these traditional treatments. But could you explain a little bit of the difference between how traditional treatments like chemotherapy, radiation, what have you work, and how these NK cell exosomes work?
Yeah. So, chemotherapy and radiation been around for a long time. In fact, when I came up in my medical training and medical school, it was the mainstay, and it still is. A lot of things don't change very fast in medicine. But those strategies, chemotherapy and radiation, the way they work is they're going to hurt all the cells in that area or in the whole body if it's chemo. And the idea is that the cancer cells are more rapidly dividing. They're out of control. They have a growth advantage. And you're taking advantage of that, these chemotherapeutic agents, catch them in the growth phase or in the division phase and mess them up and cause them to, die at that time. You're hoping that you catch them faster than you poison your own cells, which are also, going through some division. So why do you lose your hair in a lot of chemotherapies? Because those follicle cells are actively metabolic and dividing and sensitive, and you lose some skin cells. And that's why the skin is usually very young and youthful after chemotherapy, because you lose some of that older cells. You think about a chemical peel, you go in maybe for a chemical peel on your face, that's chemotherapy to the outer skin in a way, So radiation's the same thing. You're hoping to catch cells in cell division faster than you hurt your own body. And that's why there are limits of how much chemotherapy and how much radiation you can have, because your own tissues do get harmed in the process. Well, NK cell exosomes don't harm normal tissue. So we really like this because it's like chemotherapy without the downside. There's no side effect. There's no nausea. There's no vomiting that we've seen. There's nothing like that. So we're very excited about the prospect here of this being a growing option or something we add to someone's overall treatment plan, which should include many things, right? It should include exercise and it should include fasting and dieting and vitamin C infusions and all kinds of different things, hydrogen water, for example. All these things have an effect to improve your biology, your cellular biology, such that your own body can help remove the cancer.
Very great. Yeah, that's amazing. Obviously, something that targets more the only the cells you want it to target, not the healthy cells, would be an option you would want to consider. Yeah. And so when thinking about these NK cells, in my mind, I would think when I first heard about them that most likely you were using a patient's own NK cells. But I understand there's some challenges with that. So what are the challenges that come with using a patient's own NK cells? And then how do getting off the shelf fix those problems?
You asked the right question. So, and the NK cells, if we taking them from the patient, if they were so functional and so great in the first place, they would have hopefully prevented the cancer or taken care of it. So again, those patients are having poorly functional NK cells. So the other challenge is it's lab intensive. You have to take a lot of blood, because remember, NK cells are only a small percentage of the blood system. Then you have to separate out those NK cells. So there's a big lab step, and then you have to get those NK cells into some kind of flask or culture situation, growing them, dividing them, and getting them to be activated to produce exosomes. And you collect the exosomes and you have to ultracentrifuge them and spin them down. So it would be, it's a huge number of steps. It's not wrong. It's just labor intensive and lab intensive, and the resources and costs are prohibitive. Well, there are some places that figured out how to get enough of the NK cells. And some of the NK cells they get are actually from donated umbilical cord, Wharton's jelly and things like that, where there are plenty of cells. And guess what? There are NK cells in there, and you get some good ones, and you get them to, make the right lab that can sort of mass produce these. And they're hard to come by. They are first available in Europe and China, and it's very difficult to get them. Luckily, through my persistence, and this is a big project for our Re-Celebrate practice, we got 10 doses, a little while ago. We have them here in the freezer. So we plan to use some of those doses intravenous and follow some of the work that they've been doing in Europe, the same protocols. We would be using them with some intravenous curcumin, which is a natural anti-inflammatory. They've had some benefits there. I would mix these up with some high-dose vitamin C infusions as well. And then we also plan on injecting solid tumors. So, and that could be lymph nodes, it could be different things. We might do that in combination with intravenous. Everyone will be handled differently, in a customized way, depending on the goal. And we need to measure this, right? We need to measure, okay, what does your PET scan look like? What are the markers circulating? And then do a treatment and then be able to see the result. And, if we're moving the needle in the right direction, then yeah, let's continue that.
Yeah, we always have a simple saying with our clients. We say test and don't guess. It's always better to test and follow up on those tests to make sure you're seeing the progress you want.
Exactly. So that's what we're doing with them. We're in the process of building a state-of-the-art injection facility where we could do 3D guided injections into tumors that are guided by a PET scan and things like that in difficult to reach places. And luckily, I'm a surgeon, so injections are, rather simple for a surgeon. It's just a needle, I mean, it's obviously a big deal for the patient, but if we can help reduce the number of surgeries and mastectomies and things like that, I would be ecstatic.
Well, so it kind of leads me to my next question, because you mentioned, maybe hard to reach places. And so is this kind of therapy something that you see being better suited for certain types of cancers, or is this kind of in general would be helpful?
No, in the clinical work and what's out there on PubMed, it's been used in both circulating types of cancers like bloodborne leukemias and things, and solid tumors. And they've even had some luck in brain tumors like neuroblastoma, which is very primitive, difficult to cure cancer. But I think the common things we see, breast cancer and men prostate cancer, this would be an ideal and simple thing to do. I mean, a prostate injection or breast injections are fairly easy to get to.
Mm-hmm. Wow, interesting. Yeah. So you're talking about all these, studies in Europe and whatnot. Can you share some success stories or case studies that you have heard of with this NK Cell Exosomes?
Yeah, so this, a lot of this is still anecdotal, but my colleagues in Europe who I've been working with to get a hold of these prized treatments have seen almost complete remissions in rather aggressive cancer situations with multiple IV treatments without the side effects like chemotherapy. So they've been sharing that with me. I have the protocols that we're going to follow. And frankly, a lot of things we do in regenerative medicine or stem cell-based medicine, which this falls under, all the good protocols and things that we've learned to do come from Europe. They've been ahead of us by about 20 years. We're a little behind here in the States. So, they have the publications, the follow-up, things like that. So we're hoping to have at least as good of results as they do. This is cutting edge. It is, to some extent, every patient is let's see how things work when you do chemotherapy. It's the same here. So to some extent, there is the experimental edge of things. But if patients are seeking alternative path to breast cancer care, whether it's cryotherapy or something like this, to avoid the traditional mastectomy and chemotherapy way to go. That's the trail we're trying to blaze for people that are open to that.
Very interesting. So if someone were to consider looking into having this therapy done, what could they expect in terms of the therapy process and the recovery process from having this type of treatment?
Well, we do a comprehensive consultation through video. Usually, most of my patients. I'm here in Greater Las Vegas, Nevada. Most of my patients, are remote and only come to us if need be. Mm-hmm. So we look at all the records. We look at all the tests. If they haven't had all the necessary tests and records, and we order them because we want to know everything we can. We don't want them to be stuck as a cog in the sick care system the watered down Kool-Aid consuming, unchanging, health insurance driven model, because that hasn't proven well, right? I mean, there's this financial incentive for chemotherapy and all that, which we don't like. And then if they're a candidate, we would offer them the option of adding or using this treatment, with full informed consent. We're not yet allowed to make any claims, but as a physician, I've really never given guarantees. No one has. But we're not allowed to make any marketing claims about these biologics. But what we're really doing is tapping back into your own biology and taking advantage of something we've learned about healthy biology in someone who, for some reason, that biology is not working properly, and see if we can temporarily restore it so it can do something naturally wonderful for us.
Mm-hmm. Very interesting. So we've been on the topic of cancer, and that's obviously what a lot of people have on mind. But I do have to ask about something maybe that some people may feel is a little more frivolous, but still something some people are very interested in. What would potentially be the anti-aging benefits of using these natural killer cell in their exosomes?
Great question. Let's make you not feel bad about being frivolous. I don't think it's frivolous, because everything we do towards anti-aging is really staving off and delaying disease. Okay. Because aging really is accumulation of disease and chronic inflammation. So it's not frivolous. It's smart. The same reason you go exercise and you get fresh air and a little sunshine, and you take your vitamins and your supplements and you eat healthy and clean and avoid things you're not supposed to have. That's all anti-aging, and that's not frivolous. So don't feel bad. Okay.
Take the guilt away.
So we should all have a healthy longevity, or what we call health span. But so we do in the clinic, we've been using sort of stem cell derived exosomes for that in many ways. But there is a protocol for NK exosomes for anti-aging, and there's a study done by a colleague of mine, a friend of mine named Rafael Gonzalez, PhD, and where they took some NK exosomes and they actually put them IV into patients, and they measured their biological age markers before and after, and they were able to show a reduction in the senescent markers. So they had fewer senescent cells. Those are the zombie cells. So if you, as a person, let's say you're my age, in your upper 50s, and you do these markers, and all of a sudden those age markers are down, you have an effective higher percentage of younger cells in your body, right? You got rid of some of those older, useless cells. So you're effectively biologically younger. And they were able to show, I think in some cases up to 2 years, those markers stayed suppressed. Wow. So think about this as sort of a age cleanse. Get out the senescent cells, in addition to exercise and hormesis, like hot sauna, cold plunges, fasting, all the other good senescent cell clearing stuff you may be doing. I'm not saying this is the best one or it's the only one, but it can be one in the bag of tools that you look into.
So you've mentioned senescent cells a couple of times. Zombie cells, I think, is what people commonly call them. Yeah. And so you've kind of explained a little bit, but just to make sure our listeners know completely what that means, can you kind of explain what these senescent or zombie cells are? And then, of course, I know you've mentioned a little bit more about how the exosomes help with those cells.
Right. Well, so we have cells, and those cells divide, and they can divide a certain number of times, and then in a copy of a copy of a copy, they become less functional. If you remember that movie Multiplicity, and you may be too young, but it's a funny movie with Michael Keaton, and he makes clones of himself, and each clone gets kind of dumber and dumber.
Yes, I have. I actually do remember that movie. That's a funny movie.
It's very funny, actually. I love that movie. But, at some point, the telomeres change and the cells are less functional. Eventually, our cells are supposed to divide and have a useful life, and then go through a process of contents renewal called apoptosis, where they die and they open up and they get recycled. The parts get recycled. Okay. So but sometimes cells are able to escape that process, and they just kind of hang out, get fat and bloated, full of junk and toxins, and float around, like someone who may have, just retired early and is living off the system And they're making a mess everywhere they go. They're actually hurting our other cells. They release small peptides that are bad. We have good peptides and bad peptides.
Mhm.
So those cells need to die, and they need help dying, and that's where the NK exosomes come in.
That's a perfect way of describing it. Thank you so much. Zombie says enough, but I like the way you described it
Yeah,
with the clone. That's perfect. Thank you.
sure.
Good visualizations. We don't want cells that are on the couch collecting from,
No,
cooking food and eating and,
yeah, just crumbs everywhere they
yeah.
go. Yeah, yeah,
Wonderful. So all of this obviously sounds like an amazing option for people to consider. If our
yeah.
listeners wanted to find more information on you or more information on this therapy, where would you suggest them reach out?
Yeah, look us up at Recelebrate. That's ReCellEbrate. Because we have that name because we're celebrating the renewal of your cells. In this case, maybe helping people with cancer. And that's our website is recelebrate.com. Our social media is all Recelebrate. I think we're the only people using that word with that spelling. So we pretty much have cornered the internet there.
That's perfect. Thank you so much, Dr. Grace, for being with us today. This was very informative.